Good morning, everyone. I too would like to acknowledge the First People and traditional owners of the lands, the people of the Kulin Nations, and pay my respect to elders past and present, and indeed extend that to any First Nation peoples who are joining us today. I would also like to welcome those of you with lived and living experience and expertise. I really do love the welcome that Vada has framed up front around honouring your unique expertise and collective strength within this community, and thank you for those of you in the room today for your ongoing work. This is my first Vada conference, so thank you for the warm welcome, and as I look around the room I'm looking forward to meeting many of you as I can today, but I've been in this role now for just over 12 months, and I do want to extend a heartfelt thanks to many of you in the room who have helped me quickly orientate across the portfolio to quickly understand what are the issues that we need to continue working on in partnership. And I've been absolutely bowled over by the depth of expertise, compassion and commitment and the work that each of you do. So thank you. I've been on a steep learning curve and I continue to work with that trajectory with each of you. I do want to talk a bit about the implementation of the AOD strategy today. And as we've heard this morning, the department very much acknowledges that services are under real pressure, and I do want to acknowledge the AOD workforce for the work that you do continue to do within that context. We know that's why reform is needed and why it needs to be both practical and strategic. Our response in implementing the AOD strategy will be in stages. Right now we're focused on the practical work that we can do to strengthen harm reduction, improve earlier access to support and lay the foundations for longer term change. Because improving outcomes means that building a system around people and their needs, not just around the limits of individual programs and service boundaries. And this is the work that we're very proud in the department to have underway. I want to highlight two areas of early progress. Firstly, the service and funding model reviews, and then also the development of the clinical guidelines for GHB. Government has continued to invest in the AOD system, including the initiatives that the Minister's spoken about earlier this morning. But we also know that the current AOD treatment system is under strain. As you've heard, as you know, it's dealing with changing patterns of drug use, growing demand and service settings that don't always work as well together as what they should. And that's why an important focus of our early reform planning work is on the specialist treatment service models, looking at how the system can be better configured to respond to both the current need, support more connected care and work for the people who rely on it. There's a gremlin here, isn't there?
Yeah, there is. It's possessed. Just taking the clicker out.
Sure. Funding approaches are part of that picture because they need to support the service model and the models of care that we're trying to build, not work against it.
Oh my God. I'm so sorry.
It's all good. As part of this work, we're also building a better understanding of what the real cost and the true costs of delivering care, and where current funding settings may no longer align with the demand that you're looking to support. Sophie will be here shortly. I do want to thank, we've had more than half of our funded service providers already share your expenditure data to support the analysis we're doing around the funding model review, and I do want to thank you for your time and contribution. This is a really important input into the broader reform work, and it will strengthen our understanding of how we ensure that the system going forward and the services that you deliver are on a sustainable footing, alongside engagement with the sector, evidence about what works and a clearer picture of what people need from the system. As this work continues, there will be opportunities for the sector to be involved over the coming year. Our broader aim is to shape service models, as I said, that are more connected, more responsive to that increasingly complex need and sustainable over time. As I said, we'll work closely with each of you through this process, and particularly with support from our peak bodies on the engagement approach. I'd also like to mention something about the work we're doing and Turning Point's work around the GHB clinical guidelines. And as you know, GHB-related harm is increasing and it presents very distinct clinical challenges that are different from those that are associated with other alcohol and other drugs. Hospitalisation, ambulance attendance and acute care presentations related to GHB have risen sharply over the past decade, which places additional pressure on an already under pressure system of emergency hospital and AOD services. So that's why we're working with Turning Point to develop evidence-based clinical guidelines for GHB treatment and management across the system. Those guidelines will support safer and more consistent care for people who use GHB. It will help reduce risk for service users, clinicians and services. These guidelines are being overseen by an expert advisory group that brings together the clinical expertise, the service delivery experience, the lived and living experience, ACHO perspectives, harm reduction expertise and VADA. And I do encourage you, if you'd like to hear more about this, to attend Professor Victoria Manning from Turning Point, her session this afternoon, who will speak about more of that work in detail. I do want to come back to a couple of the initiatives that the Minister talked about this morning, that we were very pleased to have strong outcomes in this year's budget, which was a really tight budget for everyone. And in particular, the Aboriginal pharmacotherapy pilot, the low-dose methadone trial, the public intox response services, and the work we're doing around the foundational system redesign and reform. Pharmacotherapy remains one of the most effective treatments for opioid dependence, but we know that the access is uneven and many people continue to face real barriers to care. And these investments in the budget this year around how we expand access and how we test new models of care for people who have not been served well by the existing arrangements. We know that there's a shortage of culturally safe pharmacotherapy services for Aboriginal Victorians, and over the next 2 years we'll support a pilot of a self-determined culturally safe pharmacotherapy model of care with evaluation built in to inform how we might continue and scale that service. The model is currently being finalised and developed by Victorian Aboriginal Health Service, VARS, in partnership with community members across the state and the Aboriginal workforce. We'll continue to work with VACCHO and Aboriginal partners on the pilot with a focus of how we genuinely reduce those barriers to treatment and strengthen also First Nations workforce participation in pharmacotherapy care. We've also had a funding outcome around how we, and the Minister said this morning, trial an innovative opioid treatment trial at EMSA, delivered in partnership with North Richmond Community Health and St Vincent's Hospital Department of Addiction Medicine. It will include evaluation of impact for people who use EMSA, as well as people who live and work around the North Richmond precinct. We know that traditional methadone programs don't work for everyone, and this is about testing a lower threshold option with a health-led service that can provide the genuine wraparound supports, with the aim of reducing those common barriers to treatment and engaging people who are highly marginalised, and particularly people who are already using the EMSA. I'd like just to talk about also the public intoxication responses, and the Minister spoke about the budget outcome. This is a really important budget outcome to have secured because the program was lapsing. So we have successfully secured another 2 years of funding, but it's not about continuing the current state. It's about what have we learnt from the last 4 years and how do we continue to evolve that model to improve and strengthen the outcomes that we've already seen. It builds on that earlier progress. It will strengthen a model that's both evidence-informed and culturally safe. It does continue the general outreach and sobering services in metropolitan Melbourne, as well as our places of safety in regional Victoria. Funding will also continue to support the independent implementation and monitoring and oversight group. This is a really important role because it advises us and the Minister around how we ensure culturally responsive reform and implement an independent voice to government around implementation. Our experience over the last 2 years has shown that assertive on-demand outreach is the most effective way to connect people earlier and more safely to care, but also more safely to health AOD, housing and social supports. That learning is what's going to shape the next phase, including an Aboriginal co-design process, Aboriginal-led co-design process. It'll be about building a more consistent health-led response, and one that prioritises safety and reduces avoidable harm for people experiencing intoxication in public places. We also had an outcome in this year's budget around how we can fund or enable the foundational work for system redesign and reform. So defining what a future system looks like, as I said, including the funding model review and also the workforce settings that are needed to support it. The current system, established in the 1990s, has not been through a full system review in the decades since. The context has changed, the patterns of drug use have changed, and the community need has changed. And the system now needs to respond to issues such as GHB, potent synthetic opioids, in ways that it hasn't been originally designed to do. So this work is much more than about the incremental improvement. It's about understanding how services need to be reconfigured or configured to meet current demand, and how care can be better integrated across health and social supports, and ultimately how the system can be made more sustainable over time. It's also about strengthening our understanding of how the system needs to respond and better support priority populations, including women experiencing family violence, culturally diverse communities, and LGBTQI+ communities. A key part of this is also understanding what future youth AOD services looks like, including how young people experience and access care. We know this reform's only going to succeed if it's backed by a workforce strategy that's both realistic and sustainable and aligned to future systems. I do want to put a plug for the Department of Health's table out in the exhibitors, because we are really pleased to share with you today and release for the first time the AOD Workforce Capability Framework. It's available now for you as a key resources for your services and your workforce. The framework you can use as a guide for career planning, workforce development for the sector, and as I said, copies of the framework are available out on the Department of Health table. So in closing, we're pretty proud about releasing the Victorian first 10-year strategy. But we know the strategy on its own is not enough, and what matters now is how that direction starts to take shape in the real world, in your services, for the communities and the people's lives. And that's why we really want you to be active partners in the work that we're doing. We do want to hear from you about what works in practice, particularly when it comes to the harm reduction and the better integration across services, and making sure that lived and living experience and leadership is genuinely embedded in the way in which we design and deliver reforms. We also want to continue to hear about where innovation is already happening, what is showing promise, and where those opportunities to strengthen or scale is what is working. We want your advice on evidence and measures that matter the most, so we can understand the problems that we're trying to solve, track progress, and know whether reform is making a meaningful difference. And just as importantly, we want to hear early about the things that are not working as intended, where there are risks, where there are unintended consequences, and the pressure points that are emerging on the ground. If you're not already involved, there will be further opportunities to contribute to some of this work that I've discussed today. Your participation will help ensure the work is grounded in lived reality. The work ahead is really significant, but so is the opportunity to build the system that we all want to see better connected and more responsive. Thank you.